Hello, everyone, and welcome to the inaugural Zoom update for Employers Against Healthcare Hikes, a coalition that's made up of small and ethnic business groups and owners, families, and community partners that are focused on finding real solutions to lowering the healthcare costs on not just Californians, but frankly, all of us across the nation. I'm John Kabatek. I'm the California State Director of the National Federation of Independent Business, or NFIB, representing about 14,000 small businesses in California, about 300,000 across the nation. And we're a proud partner of this very important group. I'll be serving as the host, the MC, whatever you want to call me, you can call me that, for today's discussion featuring a couple of the best and the brightest in healthcare solutions. While this kickoff chat is a taped version, as more in a webinar fashion, we look forward to convening future ones where our coalition partners and others like you can hop on, ask questions, and share thoughts. The theme of today's discussion is reining in healthcare costs in 2023 and beyond. I know I sound a little bit like Buzz Lightyear, don't I? Well, soaring medical costs for families, small businesses, and others is not child's play, not Mickey Mouse, that's for sure. According to our organization, the NFIB, rising healthcare costs has remained the #1 concern among small business owners, not just in California, but nationally for the past 35 plus years. 20 years ago, almost half of our nation's small businesses offered health insurance to their employees. When the Affordable Care Act passed in 2010, that number had fallen to just under 40%, and today it stands at just about 31%. Many employers are telling me, frankly, that the cost of health insurance and healthcare is so high that they no longer run a widget shop, they run a healthcare services operation that just happens to offer widgets. So no doubt it's a growing concern and one that needs to be addressed. And that is why I'm so thrilled that we're joined by two of the best and the brightest to share their thoughts on this issue here in the Golden State and nationally. With us is Alex Schreiber. Alex is the Executive Director of Better Solutions for Healthcare, a national coalition that is focused on rising healthcare costs and finding solutions. Previously, Alex was Chief of Staff to Congressmember Bradley Byrne of Alabama, and he's a member of the Board of Directors for Reform Alabama, which is focused on promoting sound government reform policies for that state. Welcome, Alex. It's great to have you.
Thanks, John. Great to be here.
Also with us is Nick Luizos. Nick is a longtime friend and Vice President of Government Affairs for the California Association of Health Plans. Nick has been the longtime advocate there at CAHP, representing various health plans and interests on healthcare front. And before that, I remember working with Nick. Gosh, this is when my hair was brown. Back when Nick was the chief consultant for the California Assembly Labor and Employment Committee. Great friend and ally and a wise owl, also on healthcare and a good friend to us. Nick, welcome. Great to have you.
It's great to be here. Thanks a lot, John.
Yeah, awesome. Well, this is going to be a fun discussion, an important discussion on a challenging topic, but I'm really glad to have both of you. Yeah, Alex, I'll tell you what, maybe we start with you. We talked about these rising healthcare costs. Small businesses have made this their #1 concern. It's not just small businesses, it's families, everyone across the country. It's still a pervasive issue. I mean, how serious is this problem, Alex, and how the heck did we get here?
Well, thanks, John, and it's great to be here and looking forward to the discussion today and beyond. And, look, the fact of the matter is the problem and the threat is existential, right? It's unsustainable. And by way of background, as you mentioned, I spent 6 years on Capitol Hill. I was chief of staff to Congressman Bradley Byrne from Alabama, and he served on the Education and Workforce Committee. He actually chaired the Workforce Protection Subcommittee. So much like the work of Nick in California, we spent a lot of time looking at things through the lens of the employer. And when I left, I helped start this organization back in 2018. And so we're now in our 5th year, really looking at the rising cost of healthcare and the role of different players and actors in that space to help us find solutions, right? Look, at the end of the day, we know that healthcare is rising at, like I said, an unsustainable rate, and employers, consumers, and taxpayers are picking up the tab. Average healthcare spending in this country was just under $12,000 per person last year. That's 50% higher than any other high-income nation, right? And at the end of the day, one of the largest drivers of that is the prices that hospitals charge for service, right? Those prices have soared 100% since 1990. And at the end of the day, somewhere between 42 and 48 cents of every dollar in the healthcare system is spent on care received in the hospital setting. And so we as an organization have really looked at the different players and the different factors that go into this to see what can we do, what solutions can we provide, because what we know, and John mentioned the impact there in California, the number one issue for 35 years, as he mentioned, 47% increase over the last decade in the cost for employers to provide healthcare. So many small and medium-sized businesses have seen healthcare go from their fifth largest to third largest, sometimes their largest expense. And so we're speaking on behalf of the 178 million Americans that receive employer-sponsored coverage to help us make sure that we can come together, speak with a unified voice, and really be a leader on these issues, because we know that there are areas that we can proactively go and fight for cost reductions that are passed on to the employers and their employees, and also make sure that we're also stopping things that are important tools in the tool belt we're going to talk about today that help keep costs low. So excited for the discussion, excited to jump in, and really looking forward to where we go from here.
Yeah, we've talked about tools in the tool belt. I know I keep referring to childhood stuff. My kids are much older, but I keep thinking of you being the healthcare Bob the Builder here. We keep talking about these tools in the tool belt, which are so important. These solutions, not just talking about the problem, but solutions. Well, thanks, Alex. Great feedback, kind of getting the landscape there. And Nick, great to have you with us, man. Great to see you. I know you've been working hard this year. We, with Employers Against Healthcare Hikes and Better Solutions for Healthcare, had a good opportunity to work together and on some good stuff this past year. Hey, Nick, tell us a little bit, what's bringing it home to the Golden State? A lot of storms going on here now at the time of this webinar. This is clearly a big health political storm these days. And what's the gravity of this healthcare cost problem in California and this storm? I mean, we always set the trend for over-the-top rules and costs and challenges and stuff like that. I mean, what's been advancing? And tell us a little bit about your thoughts. I know you have some stuff to share on that front. So
yeah, no, thanks, John. And I'd like to start off by thanking you and Alex. It's been great working with the coalition, on various issues. We have a pretty solid relationship with the large employer community, through Cal Chamber. They've been there. One of the voices that, we really want to bring on board is the small business voice. I think, with respect to policymakers in California, it makes a difference to have the small business voice there. So really appreciate, the work that we've done together on various issues. So I thought I'd start with some table setting, if that's okay. And I wanted to do that via a PowerPoint presentation that I have, which I will get started here. So this is something that we've used with policymakers as we get to know them, and I thought it would be a good first step in kind of laying the groundwork for more specific discussion about the lay of the land in California with respect to health plans and cost. So just to start off who we are, just quickly, CAP represents 44 fully licensed health plans in the state of California. We have a lot of variety amongst our membership. We have, for-profit, public, nonprofit health plans. They're in all types of markets, all of the markets, individual, including covered California, the employer market, of course, both large and small, and in the Medi-Cal space. So we've got a lot of variety in California. I will just mention as well is that there, comparative to other states, we do have pretty healthy competition and choice in the various markets. Most counties have anywhere between 4 to 20 health plans for consumers to choose from. So that is, I think, a very significant fact. But focusing specifically on cost, here you'll see a breakdown of the healthcare dollar. A couple of features here that I think I should mention is that California's health plans are very heavily regulated. We have rate review in the state of California, both for individual and employer plans. We also have, a medical loss ratio, which was instituted as a part of the ACA and, implemented in California as well. What do these rules mean? They mean that premiums in the state of California are tied to the underlying cost of healthcare, and that a majority of the healthcare dollar is spent on direct medical services. And that specifically is the medical loss ratio rule, which states that 80 to 85% of the healthcare dollar needs to be spent on direct care. You'll see here a breakdown of the healthcare dollar. The latest facts and figures we have is $207 billion. And if you do the medical loss ratio kind of formula here, there's about you'll see the regulatory cost breakdown and other types of healthcare expenditures there. I think the long and short of it is that if premiums go up or down in the state of California, it's largely a reflection of the underlying costs. And the biggest cost drivers in the system right now that we're seeing are hospitals and drug costs. Here's a little bit more specifics on what I just talked about in terms of where the healthcare dollar must be spent, where the premium dollar must be spent. Another feature is that if health plans don't meet our medical loss ratio requirements, we have to rebate consumers. So that means, about 15% is left over for administrative functions, regulatory functions, and the rate of return for plans. Again, health plan premiums are tied to medical costs. When the price of the underlying costs fluctuate, so do the premiums. Here you'll see healthcare accounts for 31% of the overall healthcare spending. Prescription drug spending in California, according to the latest data, increased by 6.6% in 2021. We're very concerned about the growing cost of prescription drugs. There's some more information I could share later on that, if you're interested and we have time. As I transition here, I do want to say that, health plans have been working hard with policymakers on, what we believe are the right approaches to, fix our healthcare system. We're interested in establishing a bridge to universal healthcare coverage in the state of California. We've supported critical policies to bring us closer to universal care and try to, restrain the growing cost of healthcare in California. Unfortunately, there are elements in the legislature that want to take a completely different track and essentially abolish our existing healthcare system and recreate it through a single payer system in the state of California, which is something that we've been battling for the last few years. And we think it's a bad idea. We think the employer community agrees with us on this.
Definitely, most definitely.
It disrupts healthcare for millions of Californians, enormously costly. It's a $500 billion program that requires at least $200 billion in taxes, many of which would be levied on employers in the state of California. It really faces a lot of impossible structural hurdles. And we've done a lot of work in this area, and we find that most people, about 70% of Californians, are satisfied with the healthcare that they currently receive for themselves and for their families. So, there isn't really, a basis for going in this direction. I bring it up, some folks, don't think that, single payer is realistic and that, it's just a political drill that we have to go through every year. Well, I would say, number one, it's a drill that distracts us from the work that we need to be doing to fix our healthcare system and to restrain costs. And they're just tenacious, so, the idea that this will never happen, well, I don't know if that's true or not, but we're doing our best to fight it from ever happening in the state of California. And so we've got to remain vigilant on this one. Just to get into specifics, I know one of the things that we might get into later is, what we think are the threats to, keeping healthcare affordable in the state of California. And so one of the things that we constantly see is, efforts to really unravel managed care in the state of California. We have a relatively, high concentration of managed care and HMOs in California, relative to the rest of the country. And what we see a lot is efforts, whether it's the hospitals like last year in SB 958, or the provider community, or the pharmaceutical companies. There's just this constant effort to erode some of the tenets of the managed care system, including prior authorization for healthcare services, and utilization management, benefit design, and other things that we use to keep healthcare at the highest quality and at the most affordable. A little bit more information about the high cost of drugs, through the transparency reports that come out every year that health plans supported via SB 17 a number of years ago. It shows that California's health plans, I should say, continue to pay over 90% of the cost of the 25 most costly drugs. We pay more than $10 billion for prescription drugs in 2020. Prescription drugs accounted for 12.7% of the total health plan premiums in 2020. And as prescription drugs increase in terms of their underlying price, so do premiums. So we're very focused on prescription drug costs and trying to fight efforts to make them even more expensive in the state of California. Here's just an example of one bill that we consistently fight. It's an example of one where it really attacks benefit design and share of cost for a specific prescription drug that's very expensive, insulin, and that is a bill that we're likely to see again this year. AB 2203 fortunately failed, but we will likely see something similar, whether it's for that drug or other types of drugs. And then benefit mandates, just quickly here, we constantly see around 15 to 20 benefit mandates every year that require health plans to cover new services or to cover existing services differently and in a way that will increase premiums. Last year, the collective number of benefit mandates equaled about $1.5 billion. And that is a figure that if they all had passed in their original form, would have increased premiums in the state of California on employers and individuals by about $1.5 billion. We have to look at them collectively. Fortunately, most of those bills kind of died in the appropriations committees or were vetoed by the governor, but most, if not all of those will be back, including some pretty expensive ones for the employer community. And happy to get into some specifics if you have questions on that. So there's a strong interest in behavioral health care, and improving that system in the state of California. Certainly, there are imperfections in the system, but a lot of the legislative efforts intended to quote unquote fix our behavioral health care service system ends up being more complicated and increasing premiums on our consumers. So that is an area of focus that I believe is going to be pretty intense this year. And so, we want to see constructive solutions that get at the actual issue, including workforce development and making sure we have enough providers in this space, as opposed to onerous new mandates on the plans and employers. Finally, 958, I know the coalition has done a lot of work on this one, and I don't want to belabor it here, but you'll see that, hospitals, which are an important and critical part of our networks, obviously, and we're proud of our partnership with them. Still, there's that effort on their part to kind of undermine and untangle some of the innovative solutions that we have to control hospital costs, and particularly specialty drugs that are delivered in a hospital setting. And so we were happy to work with you last year to defeat SB 958. But we're likely to see something again if what the author of the bill last year said is true. She'll be reintroducing the bill, or someone will be reintroducing the bill. And so hopefully we'll be able to work again on that one.
We're definitely known to recycle here in California, including legislation, right, Nick?
Absolutely, yeah. So I think that's it. Here's some things that I'll be forwarding to you, John. I think you have links to these already that you can share with membership, but that's just kind of a baseline, and hopefully that's helpful to kick off the rest of the discussion.
Oh, that's fantastic. Thank you. You talk about single payer. I think you're right. They're just relentless. The proponents of that I mean, who doesn't want something that would be run as well as the Employment Development Department in DMV, right?
Yeah,
Come
exactly.
on. Something, all joking aside, something as important as healthcare for our families and neighbors and friends and workers should be left in the right hands and then responsible. Thank you, Nick. Awesome stuff. Hey, Alex, back to you. Nick hit upon this whole hospital and healthcare providers. Look, we all know that they've been great partners in communities and they help us and they heal us and our families, and they do have an important role. But gosh, I'm seeing this slide deck and just other discussions that we've seen, a lot of the times they seem to be at the root of these soaring costs, at least a big part of it. Alex, why is that? What's going to have been advancing? What's at the heart of what they're doing that's really making these costs go up so much for not just patients, but so many others?
Well, that's a great question, John. And I think let's take a step back, right? Because I always like to describe, healthcare at sort of a 30,000-foot macro level as really two things, right? Cost and coverage. And whether you like the legislation or not, the majority party in control at the federal level in 2010 passed a piece of legislation in the Affordable Care Act intended to address coverage. And really, as Nick mentioned, we're seeing more and more effort to make sure every American is covered, right, through some form of healthcare services and protections. And now, over the past decade, you're seeing more and more of a focus on cost. And there's different players and industries and entities in this healthcare delivery system. But what we've seen is even at the federal level last year, again, a piece of legislation, like it or not, the majority party passed in the Inflation Reduction Act intended to address costs. And now we're seeing more legislation be introduced at the federal level here in Washington and in the states addressing this concept of rising costs, right? Because as I mentioned earlier, we're seeing more and more outpacing inflation, outpacing the rising costs we're seeing throughout America, this rising cost of healthcare. And so we as an organization set out to dig in and really understand the who and the what behind that, because we're all taught from a young age to trust your doctor, and certainly we do, and we appreciate the partnership and respect we have for healthcare professionals, but we wanted to really understand the other side of the house, right? What we set out to do is to understand the policies and procedures that have been put in place and the practices that have led to some of these astronomical price increases that ultimately get passed down to the employers and their employees in securing quality coverage for themselves and their families. And so we've really drilled into a couple of areas that I'm gonna walk through now. The first is this concept of hospital monopoly control. More and more, we're seeing major hospital systems buy up competition in local markets. These are not independent rural hospitals. These are large conglomerates that are wielding their monopoly power to charge egregious price markups. Nearly 70% of all physicians in this country are employed by hospital systems and corporate entities. And I think it's important to understand that really that's one of those driving market forces beyond the care and coverage you receive that affects the cost of that coverage. The second is the transparency. We've seen legislation at the federal level. I know there's been efforts in California, as Nick has mentioned, around understanding the transparency and enforcing some of these transparency laws to make sure that our healthcare isn't operating in a black box, that consumers understand the cost of what they're receiving, and that hospitals are complying with these laws. And then next is really these hospital price markups. We talked about that number of the healthcare dollar and what's spent not only for receiving care in a hospital setting, which is the most expensive place in the country to receive care, by the way, but also some of the other things such as specialty prescription markups, right? And so we as an organization, Nick mentioned some of our efforts around the so-called white bagging legislation last year, but we really see that as one of our tools in the toolbox to help keep costs low for employers. It's innovative, it's safe, it's patient, it's really patient first, and it's something that we believe is a critical tool that we'll continue to fight for. And then finally is this really important issue of dishonest billing. And I think you're going to see more and more focus from us as an organization and our affiliates around the country over this idea of facility fees and designated care, right? We know that on average, care received in the hospital is up to 300% more than a care delivered in an office-based setting. And you're seeing more and more acquisitions of these outpatient facilities that are then starting to act like, bill like a hospital for the same from the same physician at the same facility that's now being charged at the rate of being received in a hospital. And so these are some of the practices and policies that we're exploring as an organization, really looking at legislative vehicles as well as regulatory to address them and make sure that we're preserving everything we can to keep healthcare costs low and look at the root of the system, right? We know that quality care is important, patient safety is critical, and we know that so many employees and employers love giving quality coverage to their employees. It's a recruitment benefit, it's a retention tool, and we want to make sure that we're helping keep those costs low and fighting together to preserve that access.
Transparency and accountability. I mean, it's something, honestly, Alex, I think all of us as consumers, we go to an auto shop, we want to know, we want that itemized. We go have restaurant food, we want to know kind of what the breakdown is, right? We all deserve to know that. Sounds like there's not as much of that on the hospital front that needs to be. First to you, Alex, again, back to you. What, if any, specific legislation is out there right now that would actually bring that accountability and transparency into effect so our listeners and our viewers can be aware of that? Is there some stuff in the hopper right now? And then Nick, I'll kick it over to you in terms of kind of what you're seeing or glancing on the landscape here in the Golden State. Maybe first to you, Alex.
Well, great question, John. And like I mentioned, there have been efforts to enforce some of the federal transparency laws that are already on the books in terms of accountability. And then I think in some of these concepts around monopoly control and some of the dishonest billing, we are seeing more and more interest from federal lawmakers. Senator Braun from Indiana and a plethora of bipartisan, bicameral members in the House and Senate introduced legislation in the 117th. We expect reintroduction in the 118th of legislation really intended to target some of these practices and policies that we know are driving up costs. And so I think you're going to see more and more focus from the committees of jurisdiction, education, and workforce, ways and means, energy and commerce in the House, and obviously the Health Committee in the Senate, looking at some of these policies. And again, coming out of this COVID era and really a renewed focus on healthcare dollar and the role that every player has in making sure that we're keeping costs low in this country.
And I should add, just wearing the NFIB hat here, of course, that our national team and our folks in Washington have been ardently joining forces, of course, to bring accountability and transparency with this type of legislation. I know there's been some omnibus legislation, but also some specific ones, and our small business owners deserve that. And that's why NFIB has not only been involved with that, but obviously was to say the very least, very, very concerned, to say the least, about some of the ramifications of the Affordable Care Act, which are coming to roost now. We realize it's the law, but we're holding that law accountable. It's why we got so involved legally and legislatively. Hey, Nick, back to you, California. What are you seeing? What are you glancing as you look at this transparency, accountability? Is there hope?
Yeah, well, so, I will say, with respect to the 2023 legislative session, I think we're going to be playing a lot of defense and seeing a lot of cost driving pieces of legislation again. I will say, though, that last year, California enacted and the governor signed into law through the budget an Office of Healthcare Affordability, which is intended to bring more transparency into the healthcare system. It was a complicated issue for CAP, I have to say, as it was moving through the policy process, but it's law. And that will gradually be implemented in the state of California. The intriguing thing about the office is that it brings in other sectors of the healthcare industry. It brings them into the affordability debate and discussion. Far too often in the state of California, the affordability problem has been brought to health plans and placed on our doorstep. What are we doing to control costs? And we're doing a lot. But this is really the first time where other actors in the healthcare sphere are being brought into the discussion in a more formal basis, I should say. And so, one of the things the office is going to do is it's going to establish cost targets for various entities, including providers and hospitals. It's all very technical, and so I won't get into that stuff right now. And there are time frames. There's going to be progressive enforcement. The health plans are a part of the process as well. I will say the one sector that is not formally a part of the office and its jurisdiction, quote unquote, is the pharmaceutical industry. I think the argument for that was that there are some federal preemption issues apparently in bringing them in. But the office is intriguing. So we'll see how that plays out. Now that it's law, we'll probably play some sort of role in its implementation and how that rolls out on behalf of our members. And while the pharmaceutical industry isn't formally a part of the Office of Healthcare Affordability jurisdiction, we do have SB 17 that I referenced earlier, which is a drug pricing transparency bill. There are requirements on the drug companies. There are requirements on the plans, and the report that comes out every year is very, very useful, I think, to policymakers and to consumers, and really shows, how much is being spent, what percentage of the premium dollar is being spent, and what the plans are able to collect in rebates and how that offsets premiums. And I mentioned that because that is a continual debate in the state of California, the role of health plans, the role of PBMs, the role of drug companies, and the rebate process and such. So, we were happy to support that bill, and we'll see how the office kind of rolls out and whether that makes a positive impact.
Yeah, no doubt. It's going to be an interesting year for sure. Alex, when we've talked, I'm coming back to Bob the Builder, the tools in the tool belt to the better solutions for sure for healthcare, and a real big proponent. I know that both you and Nick and health plans and all folks are just about like not just complaining and talking about the problem, but what are some real things that we can do to fix this? I mean, for our viewers and for others out there, what are some steps people can take? We certainly want to know how people can get involved for sure, but what are some calls to action? We're real big believers in looking at this year of 2023. What are some things that you think people really could and should be thinking of, and how they can get more involved?
Well, that's a great question, John. Certainly appreciate the conversation today, and look forward to continuing to track legislative activity report here from Washington as the 118th Congress gets off and running. But really, our focus at Better Solutions for Healthcare is again on this ever increasing burden of healthcare costs, and really this has prompted local and state business leaders of all shapes, sizes, and backgrounds to come together, educate stakeholders, right, be a voice to lawmakers, and really have an impact in the regulatory environment on this idea of hospital cost drivers and support effective market-based solutions. We believe that at the end of the day, this is going to be the best of the public and private sector coming together to support these market solutions to solve them. Better Solutions is monitoring legislative activity in Washington and across the country as more and more anti-competitive, cost-increasing proposals emerge. As you heard, we're going to play defense where we need to and go on offense when we can to activate and mobilize local businesses like folks listening today to defeat these harmful policies and support policies that we know will help keep costs down. And so, our principles, you've heard them multiple times: transparency, accountability, competition, and free markets. And so I encourage folks to learn more, to get involved, to have their voice heard. You can visit us at bettersolutionsforhealthcare.org. Check out our social media pages, our website, learn about our issues, where we stand, how we're getting involved, and really lend your voice to the fight. This is, as John said, the top issue for over 3 decades for employers, and one that we believe we can have a major impact on this year in 2023.
Excellent, thank you. And that is, again, bettersolutionsforhealthcare.org. Bettersolutionsforhealthcare.org. Check it out and get involved and find out more, but most importantly, be informed and engaged. And this is great. Thank you, Alex. Great. Nick, same to you. kind of looking ahead, having tools in the tool belt, anything that Alex didn't hit upon where people can get involved, and also be sure to let it, to the egregious plug part of the webinars, of course, let people know how they can, of course, be involved and find out more through CAHP. So.
Yeah, I mean, we have a great communications team that put together my presentation and all of the wonderful one-pagers and fact sheets that we've used throughout the years. There's a plethora of information on our website, calhealthplans.org. I encourage you to go there to read more about us and to read more about the issues that we deal with. And other than that, I would really like to continue to stay connected. Again, as I said, the small business voice is one that is really crucial, particularly for members of the legislature. When they hear from a large business, it makes an impression, but when they hear from a business that's in their district, it's a little bit different. So have really enjoyed the work that we've done thus far, and we'll see what the legislature has in store for us for 2023. It's very early.
Yeah, we've no doubt about that. I've said sausage, we all know the sausage is still being made. I said in California, I think it's like habanero chorizo sausage with all the spicy stuff in there. So, and sometimes gives you a heartburn. So.
Yep. Well, the budget just was introduced by the governor while we were on this
yeah, I know.
Zoom. So let's see if there's any goodies in there for us.
Awesome. And then back to just finally, certainly with NFIB, our small business organization, we're only as powerful and vocal and engaged as we are of our membership as Better Solutions, and certainly Nick can tell you with plans. And you can find out more about us at nfib.com, nfib.com. We're 14,000 members strong in California, but with 4.1 million small businesses, we have an opportunity to be a much bigger army, and we need to, especially coming out of this whole pandemic and looking ahead at this year. So nfib.org, there's a California page, and certainly information about healthcare. But I really encourage a lot of people to get involved with Better Solutions for Healthcare.org. It's a great coalition, and we just, again, I think that's some amazing information, and Alex, that's awesome. So we really appreciate both of you, Alex, Nick. It's great to have this discussion. I know we'll let you get back to either the wild happenings in Congress, Alex, or here under the state capitol closer to home, Nick. But I know that this is going to be a busy year as you're fighting to make sure consumers and small businesses and families get the lower cost that they deserve. So thank you both so very much. We'll look forward again to all of you, to welcoming you to future Zooms and future updates, either in person in your neighborhood, or certainly ones where you can Zoom in and ask questions and share your stories and your thoughts. That's the best way to get these things done. So thanks again. Happy New Year to everyone.
Sounds good.
And really appreciate both of you being with us today.
Thanks, John. Thanks, Alex.
All
Thanks,
right,
John.
gentlemen. Take care. Bye.
Great.